Amber, thanks again for answering some questions for me. I think I have a great idea of where Concentric can go with a solution for you. But before we go there, I'd like to go back to how we got the meeting in the first place, which was the discussion about what a must-have or the 10 must-haves should be for an occupational health program. About a few years ago, Concentra reached out to their clients and sat in a forum with them to really understand what they were looking for in an occupational health provider. What we learned is that they were relying a lot on us on what the best thing, what a must-have should be. We got some great information from them. We then looked to external research, like the American College of Occupational Medicine, reached out to the American Medical Association, along with some other pieces, and then went into our own library of providers here and gathered some information from them with their expertise, and we put together this tool here. And this is what we believe, this is what the research states as the 10 things that you need in a strong occupational health program. So based on our conversation today, there were some key areas that you were missing that you really need based on what's here. One would be the ability to build a relationship with a physician. Right now you have a medical director that is at your facility, but he's focused on the patients in your home, the elderly population that's there. You need a physician. The employer is looking for a physician that understands an occupational health program and understands where injuries are happening and understands what they can do to help minimize those. Along with that, you need a provider that can help articulate the importance of getting back to work with your employee. Looking down these must-haves, you asked me about how difficult is it to send someone out as opposed to having injuries taken care of in-house. Yes, there is a convenience factor that we have to overcome. But the reality of it is that Dr. Smith's only here 3 days a week, and you are sending people out. And with the research having, people are looking for facilities that are more welcoming, places that they would go themselves. And you mentioned a few times that Dr. Smith's very hurried. He doesn't understand what's going on sometimes with their work as opposed to what his normal population is. So I think when you look at the research, you're looking for two things. One is a welcoming facility, but also a facility that has everything in-house. Make it convenient for your employees so if they do have to go out, then they can take care of X-ray, PT, possibly even specialist services, all within the same roof. The next phase of the 10 must-haves is a communication aspect. Employers are doing more with less. So you need to be able to get information from whatever partner you deal with electronically and immediately, as well as have the ability to communicate via phone, have that interactions. And then there's the expertise. I think the biggest deficit in your program right now is the fact that your provider is not focused on occupational health. He is a great physician. You have a great relationship with him, but his big thing is the ability to take care of the elderly patients that you deal with. And you need a provider here. Looking at the research, employers looking for providers that understand or have an early intervention medical model. They understand how to get people back to work, and they can articulate what that model is. Along with that, you want the ability to provide a report card or reporting back on what those outcomes are. I asked you how many lost time cases you had, and you said 10. I asked how long they're out for, and you weren't sure. And part of that is that you haven't been looking at it that way. You just know they've been out, and you've been trying to reduce that. But you should be able to work with your provider to get some of those statistics and understand is it getting better over time. So what we did is we took this information, and for the purposes of our conversation here, where Concentra fits in is that we took this information, we reevaluated our program, and we realized that we weren't great. We had some great centers out there, but not consistently hitting on a lot of these must-haves. So we broke out these must-haves into 4 keys. One is employer engagement, how we work together. 2 is patient engagement, what happens when a Concentra patient goes out to Concentra employee goes to one of your employees goes to a Concentra. 3 is clear communications, and that's the communication strategy that we put together. And lastly is the expertise we bring to the table. For the purposes of our conversation and the challenges that you have with leaving your premises to practice to send injuries, I want to focus on employer engagement as well as the quality medical outcomes. employer engagement. If you look here, Concentra's employer engagement consists of two things. One is creating a profile for you that's customized for you. It has your instructions based on your needs. Two, our providers and our therapists learn your practice and learn by going on site, by having a tour, as well as, in this case, bringing our therapist out to tour and understand your facility. Those two things, combined with providing our expertise and recommendations, will help us understand your injuries when someone gets hurt and comes in, therefore minimizing the lost time that you have right now. The other key is the medicine itself. So with over 30 years of experience in occupational health, we focus on an early intervention medical model. It means if someone gets hurt today and they need PT or a musculoskeletal injury, they're going to be referred that same day to get that injury going. Compared to what's happening now, when someone gets hurt, they go to the emergency room or they wait for Dr. Smith, and then 2 to 3 days later, they follow up with Dr. Smith, and at some point, they end up in therapy or chiropractic care. The time you're losing in between that is valuable, and I think that's the single most biggest change that you'll see by partnering with Concentra. And along with the medical model and the expertise, there's the access and the outcomes. At the end of each quarter, here is a sample of the reporting that you and I will review. It has it's a Colorado level 3 utilization report, but it's designed to show you key statistics of how we're doing and how we're managing your care. Key statistics like how many cases were taken out of work, the length they were out of work, how many were referred out of our system, and the overall average cost per case. So I think those two keys specifically will solve many of the problems that you've encountered so far. What I'd like to do is invite you to our facility, meet our provider, and during that meeting, I'll focus more on the patient engagement piece, what your employee would go through, and then I'll tie in the clear communications and what you can expect from our communication package. What do you think of next Tuesday? Does that work for you? Excellent. Thank you.